Alrighty guys, welcome back to another video, and in today's video we'll be doing a practice question over drugs for heart failure. So yeah, let's jump right into it. A 72-year-old woman is brought to the emergency department by her daughter, who reports that her mother has been confused, nauseous, complaining that everything looks like a yellow, green halo around it. I'm gonna circle that or underline that because that's an adverse reaction to a medication for the past 2 days. The patient's medical history includes heart failure with reduced ejection fraction, AFib. Her medication includes cardiolol, lisinopril, furosemide, and an oral inotrope agent, which is probably the one we're looking for. Her vital signs are stable, but an ECG shows premature ventricular contractions. Laboratory studies reveal a serum potassium of 2.8. We're going to underline that because that's another clue. The drug responsible for this patient's symptoms exerts its positive ionotropic effect primarily by directly inhibiting which of the following. So now let's look at the answer choices. So we're going to have A, which is going to be beta-1 adrenergic receptor, which is going to be dobutamine, which is a positive ionotrope, or has a positive ionotropic effect, but it's not going to give us that yellow-green halo adverse reaction that we're seeing in the clinical vignette. Let's see, B, which is going to be PDE3, and that's going to be something like militerone, or I'm not sure if I'm saying that correctly. And with that one, adverse reactions you're going to see is like arrhythmias and hypotension. Okay, and then we have C, so that's going to be voltage-gated L-type calcium channels, and that's going to be things like amlodipine, which you'll see like the peripheral edema in legs or leg swelling. Another one that is going to be like veramopil, and that's going to be like, for that one, I think it's constipation if I'm not mistaken. Then we're going to have a sodium, potassium, ATPase pump. And that most likely will be our answer because, and I forgot to write this earlier, but that sounds like digoxin tox. And then we're going to have sodium calcium exchanger, which digoxin does have an indirect effect on the sodium calcium exchanger, but the vignette is asking for a direct inhibitor. And so that direct inhibitor will be the sodium potassium ATPase pump. And so D would be our answer for that one. And let's go back into why I think it's the answer that we have chosen. So the patient is presenting with the classic signs of digoxin toxicity. So we're going to have the nausea, the yellow-green halos, cardiac arrhythmias or PVCs. And then digoxin toxicity is going to be exacerbated by a low potassium level. And so to combat this, we would give digibind. But overall, digoxin exerts its effect as a positive ionotrope on the sodium potassium ATPase pump, and it also indirectly affects the sodium calcium exchanger as well. So if this video helped you, feel free to give a like, comment down below if you guys want to do any particular subjects or anything like that. But yeah, thank you for watching.